Okay. Okay, so now what I want to do is demonstrate to you all how to test skin integrity and skin sensation like we talked about online. So Dr. D is going to be our patient here, and we are going to pretend that we're going to do an ultrasound treatment to her right elbow, okay? So what I want to do is I want to look at, first of all, after I've greeted my patient, and all, I've got her pain level. What's your pain like?
It's so bad.
It hurts bad.
My pain level's bad.
Well, 0 to 10.
0 is good.
Yeah, 10's bad.
10's bad.
Emergency room.
4.
Okay. Okay. So she's got a 4 pain. That's doable. So before we do anything, we need to make sure that she has intact sensation, and that her skin is clear of abrasions, bruises, rashes, any cuts or anything like that that might be open. Okay, so I'm going to start on the affected side, which is, we're going to pretend this is our affected side. So we're saying I'm going to do the ultrasound to the lateral part of her elbow here, around her lateral epicondyle. So I'm going to look around here. So skin looks closed. I don't see any rashes. I don't see any cuts or abrasions. I don't see any bruises. Temperature feels a little warmer, but sometimes you would expect that if there's something going on. Now let me come here to this side. So no rashes, no bruises, no cuts, no abrasions. Temperature actually feels a little bit cooler over here, but you would expect that on the non-affected side. So skin looks pretty good. Okay, so skin integrity is good. Now we're going to test her sensation to sharp and dull, and then to hot and cold. So let me do hot and cold. Let me do sharp and dull first. I'm not ready for this. So for this, I'm going to use this rounded tip. And we actually do use sharp and dull objects. So a lot of times you will use a safety clip or something like that, or a safety pin. So this is going to be the dull side, and I will just touch your skin like this. And this would be the sharp side. And this does have a sharp tip, but it's not going to cut her. So this would be the sharp. And you always want to start, on the non-affected side. And you do want to let them watch you and see what it feels like and what you're doing. Okay, so I'm going to say, Miss Dr. D. Wait. Oh, yeah, this is non-affected. Sorry.
They both hurt, but this one hurts more.
Okay, so this is what dull feels like. Got that?
Mm-hmm.
And this is what sharp feels like. Can you tell the difference?
Yes.
Okay, so now you're gonna have her either look away or close her eyes. And depending on, different authors say different things, but I was always taught to go test 5 times, and you take the best out of 5. Okay, but you alternate which you're gonna do, and you don't let the patient see what you're doing. So if you turn your head or close that way or close your eyes. Okay, so when I touch you, I want you to tell me what you feel, sharp or dull.
Dull.
Okay.
Sharp. Dull. Sharp. Sharp. Sharp.
Okay, she got every one of them right. She had a little trouble with one, but she got them every one right, so that's good. So her sharp and dull on the uninvolved side is intact. So now we'll move to this side. Okay, so same area as on the other side. And then again, let her have a practice run, because this is the impaired side. So this is what dull feels like, and this is what sharp feels like. Okay, so close your eyes or turn your head. Okay, so what does this feel like?
Dull.
And this?
Dull.
And this?
Sharp.
And this?
Sharp.
And that.
Dull.
I think that was 5. I might have did 6. But she got all those right too. She had trouble with 1, but she got 5 out of 5. That would be normal for sharp and dull. Okay? Okay, take 2. Okay, now we're going to continue with this sensation. Now we're going to do hot and cold sensations, okay? So we're going to start on her uninvolved side, and we'll test her sensations to hot and cold. Now, some clinics have test tubes where you can have different hot and cold liquids in it. What we've actually done is we've taken a cold pack and a hot pack and we put a reflex hammer in there. So the metal end of the reflex hammer was in the hot pack. So, well, that's her involved side. But this side was in the cold end, so this side is cold. This is the best we have for now. Use what your clinic has at hand. But if all else fails, stick one in the hot pack and stick another in the cold pack. So, okay. So first of all, we have to show our patient what cold and what hot feels like. So this is cold. Is it still cold?
Yeah.
And this is warm.
Oh my god, okay.
Okay,
Got it.
difference. Okay, so turn around, turn away. So what is this?
Cold. Hot. Hot. Cold. Cold.
5 out of 5. She got them all. Okay, now we'll move over to the to the involved side. So
Look away.
let's let her see what it feels like. So this will be cold. This will be warm or hot. Okay, so look away. So what is this?
Cold. Hot. Cold. Cold. Cold.
Okay, she got them all. So that is how you test skin integrity and skin sensation. So for documentation purposes, we would write patient displayed bilateral skin integrity intact, or you could say no rashes, bruises, abrasions, or cuts. And then we would say she had intact sensation to light touch, or I'm sorry, to dull and sharp. Sharp and dull, and hot and cold. Yes, she had intact sensation to hot and cold. Sorry, my tongue get tangled. And then that's how you would document that. And you would document that in your objective section before you do your modality, right? Okay, so that is sensation.